Walking to her mailbox used to be a painful venture for Mary Lou Beruzowicz because of pain in her groin caused by deterioration and arthritis in her hip.
I always thought hip pain would start in the hip, not the groin, and my hip really didn't hurt, but I couldn't walk very well, and the further along it got, the more it hurt to even go to the grocery store, let alone a big box store. I just couldn't do that anymore.
But that's not the case anymore.
Of course, when that starts impacting your life, you have to do something about it.
In May of 2012, Mary Lou underwent an anterior total hip replacement performed by Dr. Brian Fissel with Premier Care Orthopedics and Sports Medicine, a division of Signature Medical Group.
I just really felt like I knew what I was getting into, and when I went in that morning, believe it or not, I really wasn't nervous. I just knew he knew what he was doing. I felt like I was in good hands. I just felt like it was going to be fine, and it was.
The Anterior Approach allows Dr. Fissel to make small incisions in the front of the thigh, going between muscles, rather than having to release the muscle off the bone, as is done in the more traditional posterior approach. According to Dr. Fissel, the anterior approach causes less damage to the muscles and leads to a swifter and smoother recovery for his patients.
Dr. Fissel is a very caring man. He came to see me in the hospital regularly and always was upbeat. And also I liked it because he told me exactly what was going to happen to me. I felt like I was really prepared for the surgery. I knew what I needed to do ahead of time.
Mary Lou followed her post-operative instructions carefully and is happy to be back to her usual activity level.
I have no restrictions whatsoever on what I can do now.